1. Medicine shortages crisis. How pharmacy supply issues impact patients and staff. 2. Medicine shortages crisis. Patients at risk, ADHD, menopause, diabetes. 3. Urgent action needed. MPs demand patient input to tackle UK medicines shortages crisis. 1. Medicine shortages crisis. How pharmacy supply issues impact patients and staff. Imagine walking into your local pharmacy to fill a prescription, only to be told that the medicine you need is out of stock. This isn't a one-off occurrence, but a distressing new normal for many of us. Community Pharmacy England (CP) warns that medicine shortages are pushing pharmacies and patients to their limits. The situation is so dire that 87% of pharmacy staff now face daily supply issues, up from 67% just 3 years ago. This is a crisis that affects us all, and it's only getting worse. The 2025 Pharmacy Pressures Survey reveals that the problem is not just a minor inconvenience, but a serious threat to patient health. The supply chain is stuck at breaking point, and the risks are real. But here's where it gets controversial. As shortages grow, pharmacists are increasingly relying on serious shortage protocols, SSPs, which allow them to substitute medications or reduce quantities without a new prescription. This might sound like a solution, but it raises serious questions about patient safety and the quality of care we receive. Think about it. Would you feel comfortable taking a different medication without your doctor's explicit approval? The list of affected drugs is growing, including essential medications for conditions like schizophrenia, ADHD, and even angina. And this is the part most people miss. The stress and frustration are not just on the patients, but also on the pharmacy staff. They're dealing with daily wholesaler shortages, increased workloads, and even aggression from frustrated patients. But what about patient safety? CP's chief executive Janet Morrison warns that as medicine supply issues remain a daily reality across the country, the risk to patient health has become a distressing new normal. We need to ask ourselves, is this the best we can do? Shouldn't we expect more from our healthcare system? The solution may not be simple, but it's clear that we need more flexibility and autonomy for pharmacists. They should be trusted to use their professional judgment to supply appropriate alternatives when the prescribed version is unavailable. It's time for a change, and we need to start the conversation. What do you think? Should pharmacists have more power to help patients in these challenging times? Let's hear your thoughts in the comments. Dr. Sheena Meredith, an established medical writer and editor, emphasizes the need for clear guidance and better communication to ease the pressure on patients and services. It's time for us to demand better for our healthcare system. 2. Medicine shortages crisis. Patients at risk, ADHD, menopause, diabetes. Imagine being unable to get the medication you rely on, medicine that keeps your child healthy, stabilizes your chronic condition, or helps you manage everyday life. Now imagine this isn't an isolated incident, but a growing trend threatening millions of people across the country. That's the reality patients are facing today as medicine shortages become more frequent, widespread, and damaging. And here's what makes it even more alarming. No one seems immune. Not those with ADHD, not menopausal women, not even diabetics whose lives depend on daily doses of insulin. This is a crisis that demands immediate attention. A recent report by the All-Party Parliamentary Group, APPG, on pharmacy has issued a stark warning about the escalating issue of medicine shortages. These shortages aren't just inconvenient, they're putting lives at risk. The APPG is calling for urgent action to address the problem before it becomes entrenched as the new normal. Among the most affected groups are individuals managing conditions like ADHD, menopause symptoms, and diabetes. But why are these shortages hitting so hard now, and who exactly is feeling the brunt? Let's dive deeper into this pressing issue. Steve Race, the chairman of the APPG on pharmacy, revealed that lawmakers have been inundated with messages from concerned constituents. Parents, for instance, are struggling to secure antibiotics for their sick children, while elderly patients wait anxiously for medications that keep them alive. Pharmacists, too, are overwhelmed, spending hours each day trying to source alternatives for drugs that should be readily available. As Mr. Race emphasized in the report, the human toll of these shortages is impossible to ignore, and deeply troubling. But here's where it gets controversial. While medicine shortages aren't a new phenomenon, they've grown far worse in recent years. What was once occasional and manageable has morphed into a chronic structural challenge plaguing both the NHS and the pharmacy sector. For example, over 9 out of 10 pharmacists, GPs, and prescribers surveyed reported that ADHD medications were impacted by shortages. Similarly, nearly 3/4 noted disruptions in hormone replacement therapy, HRT, and diabetes drugs, while 44% flagged shortages of antibiotics. One particularly striking account came from an individual with ADHD who resorted to self-medicating with cannabis because methylphenidate, a critical medication for managing their symptoms, was consistently out of stock. The consequences of these shortages ripple far beyond inconvenience. Patients struggle to access the treatments they need, which can lead to serious harm to their health and overall well-being. In some cases, delays in care result in unnecessary suffering, frustration, and anxiety. Those with chronic conditions often bear the heaviest burden, as they face additional hurdles finding information about out-of-stock drugs and navigating alternative options. So, what's being done to tackle this mounting crisis? The APPG has outlined several recommendations aimed at better supporting patients and strengthening the supply chain. One promising step involves exploring changes to pharmacist prescribing protocols. Under current rules, pharmacists are limited in their ability to adjust dosages or substitute formulations when shortages occur. However, empowering them to make such decisions could alleviate some of the pressure on the system and ensure patients receive timely care. Henry Gregg, CEO of the National Pharmacy Association, NPA, echoed this sentiment, stating that sending patients back to their GP for prescription adjustments is both impractical and dangerous. It risks delaying treatment, or worse, causing patients to skip doses altogether. And yet, despite these efforts, challenges persist. According to the inquiry findings, more than 8 in 10 pharmacists encounter daily shortages, leaving them to spend countless hours sourcing alternatives and calming distressed patients. One pharmacist described the situation as constantly firefighting, highlighting the immense strain placed on frontline teams. This raises an important question. How can we expect pharmacies to expand their clinical services and contribute to NHS recovery if they're bogged down dealing with supply disruptions? To its credit, the Department of Health and Social Care acknowledges the gravity of the situation. A spokesperson pointed out that the government inherited ongoing global supply problems but assured the public that robust measures are in place to mitigate disruptions. Efforts are underway to bolster the resilience of medicine supply chains and prevent future crises. Additionally, the government recently pledged £617 million over 2 years to support community pharmacies and enhance patient services as part of its 10-year health plan. Still, many argue that these steps may not go far enough. Should governments take greater responsibility for ensuring the stability of medicine supplies? Or does the solution lie in giving pharmacists more autonomy to adapt to shortages as they arise? These are questions worth debating, and ones that deserve your input. Do you think the current measures will suffice, or do you believe more drastic action is needed? Share your thoughts in the comments below. 3. Urgent action needed. MPs demand patient input to tackle UK medicines shortages crisis. A groundbreaking call for action is shaking up the UK healthcare landscape, aiming to tackle the persistent issue of medicines shortages head-on. MPs are urging the creation of a national patient advisory panel as part of a comprehensive strategy to address this critical problem. On July 8, 2025, the All-Party Parliamentary Group, APPG, on Pharmacy released a detailed report outlining 12 recommendations to combat the growing crisis of medicines shortages in the UK. One of the key proposals is the establishment of a national patient advisory panel on medicines shortages. This panel would serve as a vital link between policymakers and the individuals most affected by these shortages. The report emphasizes that economic factors often overshadow patient welfare, leading to regulatory frameworks that inadequately protect patient interests and exacerbate inequalities. By including patient representatives in the oversight of shortage responses, the voices of those directly impacted can be heard at the highest levels of policymaking. Including patient representatives in the oversight of responses to shortages would ensure that the voices of those most affected are heard at the policy level. The report states, the panel would provide valuable feedback on the impact of shortages and contribute to the development of contingency plans, making the system more responsive to real-world patient needs and better equipped to address access inequalities. Another significant recommendation is the development of patient-centered pathways for managing shortages in local systems. This approach would involve coordinated efforts between primary care, community pharmacies, and specialist services to ensure equitable access and continuity of care. For instance, imagine a scenario where a patient in a rural area faces a shortage of a crucial medication. A patient-centered pathway would ensure that this individual receives the necessary support and alternatives, maintaining their health and well-being. The APPG also supports pharmacists' ability to make dose and formulation substitutions during shortages, a move that could significantly alleviate the burden on both patients and healthcare providers. Additionally, the group calls for an independent review of the UK medicines supply chain, emphasizing the need for a robust and resilient system. The Royal Pharmaceutical Society's medicines shortage policy aligns with these recommendations, advocating for pharmacists to have the authority to make minor adjustments to prescriptions in case of shortages. This flexibility can be crucial in ensuring that patients receive the care they need, even when specific medications are unavailable. In February 2025, a cross-party group of MPs wrote to Health Secretary Wes Streeting, urging an urgent review of medicines shortages. Their letter highlighted the growing concern and the need for immediate action. Steve Race, chair of the APPG on pharmacy, commented on the report, stating, medicines shortages have moved from isolated incidents to a chronic structural challenge for both the NHS and the pharmacy sector. As the government recognizes and invests in the expanded clinical role of community pharmacy, we must ensure that the medicines supply chain supporting this care is equally robust, resilient, and patient-focused. Race further emphasized, pharmacy is central to NHS recovery and transformation, but frontline teams cannot safely expand clinical services while daily supply disruptions continue to impact patient health. Medicine security must be treated as a core component of NHS planning, alongside funding, workforce, and digital infrastructure. Janet Morrison, Chief Executive of Community Pharmacy England (CP), echoed this sentiment, saying, the recommendations in this report reflect what we have been advocating for years. It is a long-standing issue that must not become the new norm. Without decisive action, we risk these challenges persisting for many more years, putting patient safety at risk. Malcolm Harrison, Chief Executive of the Company Chemists Association, welcomed the report, noting, this timely report by the APPG once again highlights the worrying impact of shortages on patients and pharmacy teams. We urgently need an end-to-end review of the medicines supply chain to ensure it is as resilient as possible, so patients can access the medicines they need, today and in the future. Henry Gregg, Chief Executive of the National Pharmacy Association, added, ongoing shortages of medicines pose significant challenges for both patients and pharmacies, and in some cases, they pose a serious risk to patient safety. As the APPG suggests, the government must allow pharmacists, highly trained healthcare practitioners, to use their professional judgment to supply an appropriate alternative medication when the prescribed version is unavailable. In June 2025, CP's Pharmacy Pressures Survey, which included over 1,600 pharmacy team members and owners of more than 4,300 pharmacies in England, revealed alarming statistics. 73% of pharmacy staff reported risks to patient health due to delays in accessing medicines, and 87% of respondents indicated daily supply issues. But here's where it gets controversial. Some critics argue that giving pharmacists more autonomy in substituting medications could lead to potential errors or misuse. What do you think? Should pharmacists have more leeway in managing shortages, or does this pose too great a risk? Share your thoughts in the comments below.